Okay, so we're going to talk about understanding the damaging effects of punishment, the case against force and shock. And I'm sure that almost everybody listening to this webinar knows these definitions, but just in case, I'm going to review them. And then what I'm going to do is tell you about some of the shock data. And I'm going to do this in a very different way than is usually done. Usually people give you the theory of something and then they show you the data. Talk about shock data. And then I'm going to give you the broader theory of maybe things we haven't thought about when we punish or use shock. And this will include not just shock collars and bark activated shock collars, but invisible fences too. So when we talk about positive, we're talking about something that's given to the animal. A reward is a positive reinforcement for a desired behavior. When we talk about something negative, we're talking about taking something away. So attention is withheld from a dog as negative reinforcement for an undesirable behavior, not petting a jumping dog, for example. And if you want negative reinforcement to act as a stop signal, you need discriminant stimuli. In other words, you need to tell the dog what will get the dog a reward, because stopping's not enough once it's a learned behavior. You can flag what you want them to not do, but you need to tell them what you can do and how good they are when it's done. When we talk about reinforcement, we're talking about a consequence that increases the likelihood of the behavior recurring in the future. And when we talk about punishment, we're talking about a consequence that decreases the likelihood of behavior occurring in the future. And more often than not, punishment tends to be aversive, reinforcement tends to be quite nice. It generally, from the dog standpoint, involves food or attention. That need not be the case, but that is most often the case. Now, I think that what we have to realize is that when people want to change behaviors and they come to you, they just want something to stop, or they want the behavior to be different. And when people reach for punishment, when they reach for force, when they scream, when they reach for a shock collar of any kind, they're not doing this because they're horrible people, they're malicious, they're deviant, they're psychopaths, they hate their dogs, and they don't care about pain. They're not doing it for any of those reasons. They're doing it because they're desperate and they need help. Okay, and they just very often, they do just want it to stop. Maybe they want the dog to stop mouthing them. Maybe they want the dog to stop chasing their 13-year-old dog who's arthritic. They are looking for solutions. And I think approaching aversive treatment, forceful treatment, true aversive punishment and shock in that way is likely to get us further than any other approach. So what I always ask people when they come to me, and I want to know what they want to do. Do they want to inhibit behaviors the dog is exhibiting? Do they want to extinguish behaviors? Boy, extinguishing is hard. You know, you've already got them and that means they want them out. They want them to go away. Do they want to modulate the behaviors? I'm fine with my dogs jumping up on me if they're invited. I would like them to wait to be invited. Okay, they're big dogs. Do they want to enhance some behaviors? Do they have some lovely behaviors that they really want to develop? Do they need to stimulate replacement of behaviors or new behaviors? A lot of people do and don't even know they need to do this. Do they want to facilitate some social behaviors? That's the most complex one in the group. And I hate to tell you this, but that's what 9 out of 10 of our clients need and or want. They don't have the words to say that, but that's what they want. So when you look at this list of things, and we'll come back to this at the very end of the seminar, inhibiting, extinguishing, and modulating behaviors, these are the putative goals for which punitive punishment and training techniques are most likely used. You don't need to use these practices, but the underlying neurobiology shows us why this may be contradictory and counterproductive. But these are the behaviors where everybody says, yep, I can stop that. So please remember a couple of things when we talk about these behaviors and you're talking to clients. Remember that many behaviors being corrected may be normal. They may just being tried out. I have young dogs. You would be shocked at the number of behaviors. Young dogs, especially if you have multiples of them, will just try or they accidentally stumble into. They may be due to age and past experience. If this is what they've done for a long time and you rescue the dog, it didn't leave its old brain. Behavior doesn't happen in a vacuum, and all of this matters. Now, there are 3 papers. They're not the extensive library of papers on shock, but there are 3 papers from 3 different time periods that I'm going to talk about with respect to shock, and I'm going to discuss the data. This is one of the first papers that looked quantitatively at the effects of shock, and it was published in Applied Animal Behavior Science in 2004, nearly 20 years ago. And it was published by friends of mine, Matthias Schilder, who has retired a few years ago, and Joanne Vanderborg, who is vibrantly publishing. And what they did to study this was to look at police dogs, Dutch police dogs. Now, Dutch police dogs are pretty good, solid dogs. And they looked at 32 dogs who had 107 shocks. And let me show you what they found. So these are all past working police dogs. These are what people would consider good dogs, okay? These are not truck wrecks. They're not rescue dogs. They're not dogs with a whole bunch of problems. These dogs bite for a living, and theoretically only when they need to. And they may do other things. But when they looked, and they didn't do the shocking during the study. What they did was they watched, they knew what the training was. They had the history of the training. They waited, and then they watched when the dogs were either free walking or doing obedience work or being put in a transport vehicle, how they interacted with their handler compared to a group of dogs in the same situation who were trained without shock. So when they looked at just free walking with their handler, these dogs put their ears back a lot more frequently than control dogs did. And they were not actively being shocked or punished. They were just walking with the handler. So there was already some suspicion on the dog's viewpoint that something might happen. When they looked at their ear positions during obedience work, again, a statistically significant difference where the ears were further back, even when they were working. So there was still some concern when they were working. When they look at tongue flicking during obedience work, and these are your primo obedience dogs. These police dogs actually compete in police dog obedience competitions. I mean, this is the foundation of their training, and yet they're tongue flicking and putting their ears back during obedience work. They frequently pick up one or the other front paw during obedience work, which is a measure that you're waiting to change a behavior and you may be uncertain. And it's a huge difference compared to the control dogs. And when you transport them back, again, they put their ear positions back. So it doesn't matter whether they're free walking, they're doing obedience, a form of working, or they're being transported. You see the fingerprints of the shock training in these dogs. So the conclusion was that being trained is stressful, that receiving shocks is a painful experience to dogs, and that the dogs who've been shocked have learned that the presence of their owner or his commands, these were all male handlers at this point in time, announce the reception of shocks, even outside a normal training context, like just walking. That suggests that the welfare of these shock dogs is at stake, at least in the presence of their owner. I think those are perfect conclusions for this paper. I think that's great. If I were a police officer, I'd be terrified because your life may depend on you being able to be saved by that dog who now may not trust you. And many police departments, not so many in the US, but many have gotten away, worldwide have gotten away from shock for that reason. Fast forward a few years later, and Esther Shockey, another friend of mine, who, by the way, is now in charge of the German military working dogs. So she's one of the people helping to run that program. And I imagine in another few years, she'll be running the entire program by herself. She is a veterinarian who has a PhD in behavior. And she took on the question of, could you use shock in everyday situations and get a reliable response? Again, published in Animal Behavior Science. They took dogs. These were laboratory beagles, okay? And they took dogs. Group A was the aversion group. There were only 5 dogs in this group, but these dogs were allowed to chase a robotic rabbit. And what they wanted them to do was stop chasing that rabbit. So they wanted to teach them not to chase a rabbit they had chased. And they received an electric pulse at the instant they touched the prey. So there was an association with touching this electronic bunny and the electric stimulus. The second group were, again, 4 dogs who received a pulse when they didn't obey recall when they were chasing the electronic rabbit. And most dogs are not, unless they've been specifically taught to drop it, stop, come back. It's at minimally a 3-step sequence, okay? And most dogs aren't taught to do that. So that was considered here. That was the group they were in, the H group. And group R was the random group, which consisted of 5 dogs that received an electric pulse arbitrarily, meaning it was administered out of any context and unpredictably, prior to looking at the electronic rabbit, while chasing the electronic rabbit, after they'd finished doing it and there was no electronic rabbit anymore. The decision at which point to administer the pulse was actually made by a random generator. They drew lots, okay, so that was fine. And their result was that group A did not show a rise in salivary cortisol level. Now, remember, group A was the group where they could explicitly match touching the prey to the shock. Very, very, very discrete. You had an action, you had a consequence. And it was absolutely in time paired, okay? However, the other 2 groups, the group where they were asked to come and were shocked if they didn't, and the random group, showed a significant rise in salivary cortisol. And when the animals were reintroduced to the research area after 4 weeks without any additional training, these responses pertained. So they were long lasting. There was long-term potentiation. They learned, they remembered, their response to that was invariant. Now, this led to the conclusion that they were clearly able to elicit an able to associate an electric shock with an action, touching the prey, and were able to predict and control the stressor because they knew it was going to happen. And as a result, they anticipated that and did not get upset. They had some control over their emotional response. 2 really important factors here that are never discussed when this paper is discussed. The first is this demonstrates that dogs have control over their emotional responses. Well, we can use that for our good. And one of the things I tell people is that if we teach dogs a version of cognitive behavioral therapy for dogs, they can learn that they have control over their own arousal levels and the extent to which they get upset. And it's very funny because people have trouble believing it in a positive sense, but they get that, oh yeah, if you're expecting the shock, you're not scared. But that's having control over your emotional state. The other thing is that this is such a discrete stimulus. This is you leaning against the farm fence where the horses are and getting a shock. And you're like, and that will be the last time I will do that. You know, it's such a discrete stimulus. So it answers the question, can we stop something? Yes, you can stop these guys from doing this. And they don't react to the shock in the same way because this is completely predictable. So we understand that pain and fear, and even though the pain and fear don't elicit the cortisol response, we understand that you can stop something like chasing a rabbit if you've mapped these things one-on-one. Very few things in life are like that. Barking. Well, when are you going to first of all, shock the dog with barking as they begin to bark, as they stare at the thing and begin to pace back and forth? Are you going to wait till they're really barking and driving you nuts? These are all the things that people do. What if the barking goes on for 10 minutes? Do you shock the dog every 10 seconds for 10 minutes? The dog's probably been barking for 5 years. You know, it's not going to be instantaneous. And in theory, if you didn't mind hurting dogs and scaring them, you could stop every annoying behavior in a puppy as soon as it started, if you could find the discrete region that was sensitive to that shock. Problem is, most behaviors are continuous. And so even if you could do that, you will not stop most behaviors. And when people end up saying, oh, I love this, it stopped the annoying behaviors. What they also need to do is take an inventory of the non-annoying behaviors, because for you to get to the place where it stopped all of your non-continuous annoying behaviors, and your continuous annoying behaviors, you also had to get to the place where it stopped your continuous and non-continuous normal behaviors. And what you will find is dogs are not offering behavior. Okay. Now, the question becomes, that's only stopping stuff. That's just deleting things from your repertoire. Can we teach something with shock? And that's the thing I'm actually interested in. Well, what do we have to do to teach somebody a new behavior? How do we change their behavior? You know, I deal with problem dogs. How do I change that? So this is a paper that was published in 2020 and got a lot of press when it was published. It was published in Frontiers of Veterinary Science. And it looked at 63 dogs that were referred to the study, and everything was disclosed in this study. Okay, this was funded by DEFRA, which is the welfare arm of the government in the United Kingdom. So there were 63 dogs referred for poor recall and worrying livestock. In other words, they were chasing livestock. All of these dogs already had a concern and some training, and that's what you need to know. Because they were brought for this study explicitly in response to an announcement that we are going to look at 3 training methods for dogs that have poor recall and worry livestock. That's a big thing if you hike across other people's properties. And in many parts of Europe, you can do that. As long as you don't worry livestock, your dogs and you can walk across properties. And, you know, if you worry livestock, this is a problem. So they had 3 groups. The e-collar group was comprised of 21 dogs. These dogs were trained using active electronic collars to improve recall and general obedience. And the people using these collars were selected and trained by the manufacturers. They were experienced trainers who went out and trained people how to do this. They were chosen by the manufacturer of those collars to be the trainers using those collars. Trainers followed approved practice as recommended by the group, including assessing the dog's sensitivity to electronic stimuli prior to training. In other words, one of the best practices for this manufacturing group is you find out how sensitive the dog is to a shock. And, you know, you don't go overboard, and with a dog who's very sensitive, use a very, very high shock. So that was one of the things they had to do. They had to pair a vibration cue with the electronic signal so that the vibration cue indicated that the shock was coming. Okay. And that allowed them to do negative reinforcement. And dogs in this group were also allowed to have positive reinforcement. They were allowed to have food as a reward, and they were allowed to also use negative reinforcement, such as lead pressure that they let up on when the dog stopped pulling forward. Okay. The second group was control group number 1. And the dogs were trained by the very same trainers who did the electronic group, the e-collar group. Same people using a mixture of food rewarded positive reinforcement and some negative reinforcement like lead pressure to improve recall and general obedience. So in other words, you know, you would put pressure on the lead, and as soon as the dog stopped doing what it was doing or looked at you, you would release the pressure on the lead. Okay, so this was negative reinforcement. And the second control group was actually dogs that were trained to improve recall and general obedience, same thing they were looking for in everything else, by experienced professional dog trainers who were members of the UK Association of Pet Dog Trainers, an organization which opposes the use of shock collars in dog training. And they were chosen to represent the best practice for the use of positive reinforcement and reward-based training. Okay, so 3 groups. an electric collar group with trainers that the companies chose. Same trainers, now using a mixture of positive reinforcement and negative reinforcement. Third group, only positive trainers, chosen again from an association that only does that using positive reinforcement. So what did we find out? What did they look at in this study? Well, these are problematic dogs, right? These are dogs that don't come back when you ask them to come back, and they worry stock. Those were the two requirements. And when they looked at this, they had two, what they called commands. I would have called on these requests, but it's fine. Come and sit. And then they had a verbal request, a hand signal, which could have been any of number of hand signals, and a lead signal. Okay. For the sit, they had a verbal signal, the traditional hand signal, and a lead signal for sitting down. And the dog, was encouraged to return for the verbal signal. The dog's encouraged to return to the trainer for the visual hand signal. And they used arm and hand extended away from the body and brought towards the body. Okay. And the dog was encouraged with response to a lead tug to come back. And again, the same types of things for sit. And when they looked at the number of errors dogs made for these commands, and here's verbal, hand, lead, sit for multiple commands, come with multiple commands, obey with multiple commands, disobey. What you found is that by and large, control group 2, the positive group, had either fewer errors than did the positive reinforcement, negative reinforcement mixed group, which actually had quite a high number of errors throughout, if you take a good look at this chart. And certainly they had many fewer errors in most, but not all cases, to the e-collar group. And you can see that the results, these comparisons were statistically significantly different. Come turns out to be hard in some cases. And you can see that sometimes more errors were occurring. And certainly come was, as a solitary command, was faster, fewer errors in the e-collar group. But once you had it as a complex command, it was best in the positive reinforcement group. Okay. So overall, the positive reinforcement group did best. Now, when you look at latency to respond, how quickly did you respond? Okay. If you look at the command given, come and sit, control group 1, control group 2 in the e-collar, control group 2 was faster for both. Control group 1 was in the middle. The slowest group was the e-collar group. And when you look at this across days, the interesting thing is that sit changes, okay? Sit becomes something that no matter what group you're in, you change across the days. And it is, I think that's telling you something about whether or not the dog really wants to be sitting there with you when they're not sure what's going on. But all of these, again, if you look at the letters pair up to be the statistically significant comparisons. And in come, there was no statistically significant comparison. They were all, even though day 5 had a lower latency, I think that what you're seeing is this phenomenon where over days, the dogs become less certain in some cases. So when they added up all their data, and I didn't show you all the data, but I showed you the Sentinel data, they found that group 2 with the positive reinforcement had the best probability of engendering the desired behavior, mainly with verbal signals. And they built up a stronger contingency between the signal, the word, and the outcome. The e-collar group and control 1 group used either shock or positive and negative reinforcement. And with good timing, as they noted, this could result in negative reinforcement across the board. With poor timing, this always resulted in what was then going to be positive punishment. And that's a key point that very few people bring out in these studies of using negative reinforcement and punishment. Very often, which you get depends on your timing and how good you are at it. And negative reinforcement over time can be as damaging as punishment because the dog still doesn't know what you want. Their main conclusion was that these are real world results. These were dogs that had complaints, and the treatment was tailored to their complaint. Okay, these are dogs that wouldn't come back and chase stock, a real life situation. And they found that reward-based training was indeed the most efficient of the methods used to treat this condition and get the response that you wanted over negative reinforcement, over a combination, and over punishment. Did you get perfect dogs? No, but the best dogs were produced from the positive reinforcement group. This is a very difficult study to do. I think they did as good a job as anybody's going to be able to do with it. And I think those are real world findings that should give everybody pause. Because between those 3 studies, you can now see that if all you want to do is acutely stop something and you can limit it and you can limit the time, an aversive stimulus can do that. But that's not the real world situation. That's not what's happening here. And there are long-term effects, even if you get an outcome you think you want. Okay. So when we think about these things, I want people to realize that there's now a large literature on outcomes of forceful behavior modification techniques, including e-collars, punishment, et cetera, and they all converge on the same set of conclusions. Dogs with problematic behaviors worsen when punished. Dogs showing any form of aggression worsen and pose an increased risk than they would if they hadn't been shocked. Dogs who delay seeing a specialist by seeing a trainer who uses forceful techniques worsen and may be more at risk for euthanasia. And dogs who see specialists but also tried balance or force-based techniques became worse and are more at risk for euthanasia. And there are numerous published studies to back up each of those conclusions. And I think we have to ask why these dogs get worse. And I'm going to go back to a slide that I talked about last week. And that's, what does the science of information transfer and communication tell us? And the reason I want to mention this is information is most usefully shared by the behavior of communicating when it wouldn't otherwise be available. So what you've got to realize is whether or not you intended to convey this information when you're using a forceful technique, the dog got the information. You communicated something to the dog you may not have intended to. Such information is not always obtained from other sources by recipients that are distant, inattentive, or preoccupied. Well, that doesn't apply if you're being punished. Information that's essentially private to a communicator that would be inaccessible to others is made available through behaviors involved in communicating. Communicators and recipients continually assess information and choose actions. And as such, their decision structures and communicating information aids in risk assessment, social cohesion, and group disruption. And that's what Joanne van der Borg and Matthias Schilder's papers show. It aided in risk assessment, and you didn't have the social cohesion you would have. Okay, it's important. So when we have social communication basics, we have a signaler who's a communicator who signals, requests, commands, instructs, I don't care what you call it, a recipient. And this is the theory now of why punishment doesn't work. Excuse me. So when you have a recipient and they get a signal, they can execute the signal volitionally. They can do it because they've chosen to do it. They could also do what you wanted accidentally. They could give you the wrong response, or they may not alter the behavior, which may not be no response. They may be responding, but what they're doing is standing there freezing because they're confused. Okay, and we don't make that sort well. So when we look at this, when you look at this large group of behaviors executing volitionally, accidentally, or a wrong response, in all of these situations, the behavior is altered, just it's altered now or it's altered later. When you look at executing accidentally, I want you to consider roles for attention signals and lag times, because the difference between executing volitionally and executing accidentally may be how you delivered the signal, the lag time, and you just saw in that paper from Frontiers that matters. And punishment and balance training never makes this distinction a focus, and they need to, because this really matters. All they do is consider how they're going to change those behaviors, and only if you get a behavior that's acceptable is it informative to them. So they've missed this whole part of what communication tells you. If you don't alter your behavior, you may not have understood the signal. You may not have even seen the signal. Depends on how well they were communicating what they wanted. You may decline the signal. You may dismiss it. You may gain information from the signal and continue as before, but with new info, in which case you'll alter your behavior later. In other words, you watched the other dogs do it, you listened, you've got the measure and the meter of good girl, sit, and it meant something to you. That's incredibly hard to assess unless you look at subsequent behaviors, which is generally not done in punishment. And punishment and balance training doesn't consider these patterns. And they are a main form of learning. Dogs who alter their behavior now may not have correctly understood the signal, and they may have been contextually appropriate, or they may not have been. But if they are contextually appropriate and it was what expected or was expected or desired, we assume that that's because of what we did. If they alter their behaviors later, or they don't alter their behavior, is that their fault? How much of that is due to what the signaler delivered? And I would argue a lot. And when we look at signalers or communicators, you know, in intentional signaling, like sit, that's a very narrow focus and it's intended. But how you behave, how you stand, and you saw this in the results of the ear flick, the paw posture, the lowered body postures in the German Shepherds that were trained very differently with shock versus no shock. In the Schilder and Vanderborg study, there was a whole bunch of unintentional signaling about how you were trusted. And by communicating, the signaler's providing information that may not otherwise be available. And the dog is listening and watching for that information. And such information can be presented in many modalities, and punishment and balance training has no space for this understanding. And it's one of the reasons it fails. And when you look at things and how dogs actually watch stuff that wasn't what you intended, this is an old paper by Nikki Rooney and John Bradshaw on social cognition in dogs who are watching spectators play in interspecific games. And this is where humans and dogs play in a contest. And when dogs are allowed to watch humans and dogs play, and the dogs were playing using dog play signals and the humans were playing using dog play signals, and it depended on who ended up in a tug getting the toy. When dogs were allowed to watch both the humans and dogs in playful interactions where it went back and forth, and everybody was happy at the end, regardless of who ended up with the toy, that's who they approached first. So they're like, oh, you got it, how exciting. If humans gave no play signals, the dogs realized the communication was incomplete, the signaling was faulty, and they wouldn't approach either of them, even if the dogs gave the right signal. And if there was a contest where there was a fight versus play, like, no, give me that, the dogs did not approach those involved in contests in the same way they approached those involved in play if they were allowed to watch the fight. And all of that is you're revealing information that would otherwise be hidden, and you're always doing it. Think about what that means. And so we need to think about signal clarity and context and what this means to people. So when we look at this, we need to remember that dogs work for accurate information that marks or indicates probabilistic outcomes. All social species do this. You work for accurate information that decreases risk. Their response can be a statement, yes, I'm done, or a question. And when you're training a puppy, I always watch my dogs, and this is what they do. It's like, is this what you want? I'm sitting slowly. Is this what you, yes. You're the recipient of their question if you're paying attention. They're the signaler. And now you have to tell them for them to trust you, for that whole signaler recipient relationship to work. You have to tell them the answer. And that means that you use the process of communicating to make information available that was previously private. Yes, that is what I wanted. Is that what happens in punitive and forceful types of training? In aversive and punitive approaches, the response to the wrong answer generally is punishment with or without pain, and social withdrawal, abandonment, or ignoring the recipient. And now I want you to think about whether any punitive system or system based on withholding information actually meets the requirements of makes information available that was previously private. Training is a communicatory sport. We have to impart information that previously was unknown. Does a punitive system satisfy that goal? And the answer has to be no. There's a difference between using a signal or a marker for that's not correct and not providing information. No can be used in both situations, and we really should think carefully about what the word no can mean to some dogs. That doesn't mean you can't mark a wrong behavior. You may be able to use no, oops, but you have to have a signaling framework where you say, yes, ooh, not quite. You have to have both for that to work. And when a good communication framework doesn't exist, any signal that tells you that you were wrong alienates and divides the group. And that decreases the probability of any collaborative effort. And when collaboration breaks down, force happens. That's what happens in every type of forceful situation. Collaboration and communication is done. And the true test of communicating is how to redress absent or ambiguous information that contributes to the deterioration of these collaborations. Note that force, pain, shock takes away all the ambiguity. So what do you do when the information's ambiguous? And the reason this matters is if you have a stressor, you get this nice normal curve where cytosolic response element binding protein, which you need to make memory, and brain-derived neurotrophic factor, which you need to stimulate cytosolic response element binding protein, has this nice middle zone. But when you've got high levels of BDNF, which are really highly desirable to make sure you get as much CREB, cortisol as it increases affects BDNF. The higher the level of cortisol you get, the lower the level of BDNF and the less you can learn. And in fact, not only can you not make these proteins and decode them, but cortisol itself, a glucocorticoid receptor, stops the decoding of these proteins so that instead of making functional memory of good things, you stop and you make either non-functional proteins or proteins that do something else. So that's the mechanism whereby cortisol, the stress hormone, interferes with your ability to make new memory. So if we want to teach you to do something, it behooves us not to scare you, not to stress you, and not to hurt you. And that's separate from, and it behooves us to make sure that we're following those rules of communication, where in an ambiguous or an uncertain circumstance, we reveal information that is useful. So what factors affect how individuals deal with absent or ambiguous information? Well, genetics, and we'll just call this shy and bold animals, outgoing animals, and reticent animals. Epigenetic effects, did you have maternal neglect pre and peri-parturient? Was mom hungry? Did you have rough handling or abuse? And your past experience. Were you abused or did you have kind care? And finally, your cognitive bias. Are you an optimist or a pessimist? If you've got a positive cognitive bias, you're an optimist and think you can recover from things. If you have a negative cognitive bias, you're a pessimist. So here's my model of how I think of this. Okay, so when I look at these things, I am looking at low aggression on this side, high aggression on this black axis. I am looking at whether or not you're withdrawn or outgoing. And I am looking at how reactive you are, how many situations you react, and the level to which you react, low reactivity and high reactivity. And we'll just look at a couple of these. So here you've got high reactivity. You're not outgoing, you're withdrawn. And you're high on the aggression axis here. You may be shy. You've had epigenetic effects. You had a terrible childhood. You were abused. And you have a negative cognitive bias. So this is the dog that would bite at last. Let's look at the dog that might bite at first. The dog who was bold, who also had epigenetic effects, who was abused. But this dog has a positive cognitive bias, and this dog's going to survive it. And you're going to get nailed at first because this dog is outgoing and has high reactivity. The shy dog who is epigenetically negative but had abuse and is a pessimist is way down in the corner. The shy dog who does have epigenetic effects, was not abused, and has a positive cognitive bias moves up a little bit. And if you can get that dog to be bold, they move up a little bit more. These are the types of models we need to start thinking about to understand the effects of our information. And we have to ask ourselves, will dogs all learn this in the same way? I want you to consider the universe of only being told what's wrong. And I want you to consider those groups of dogs with those 4 categories being affected. So you're only being told what's wrong. So here's your universe. No. By the way, there's a yes in there. There are the learning slides. So that's why I was saying what I said about the stress response. You get a very low BDNF and you can't make proteins. And then you have glucocorticoid receptors and they stop the decryption of protein. So when we look at the genetics, here's the shy bowl, whether or not you have epigenetic effects, whether or not there was abuse, and whether or not you have a positive or negative cognitive bias. So when you look at these guys, and I've not put every axis that you could put in here, but the black is the aggression, so it goes up on the z-axis. Withdrawn versus outgoing, so this is the shy bold axis. And then low reactivity versus high reactivity, how many situations you'll react in. And you can see that the dog that would bite it last is highly reactive. The dog who will bite it first is over here. And that dog had epigenetic effects, was abused, but it has a positive cognitive bias. And the extent to which you react very much depends on these things. So, you know, we've got all of our shyer dogs down here, sort of on this side, if we drew a diagonal this way, and the bolder dogs over here. But we have to ask ourselves, you know, what if they're told they're only wrong? Okay. What if they, you know, here's the yes. And in order to get to, yes, that's actually what I wanted you to do, you have to get through all these no's. So fear is an individual's response of what's punishing or what the punisher is. And I hate to tell you this, a punisher needs to be viewed in terms of the individual receiving it. You may not intend to punish, but if that individual is receiving that as a punishment, you have to consider that individual's worldview. And while fear is not the definition of punishment, it can be one of the outcomes. And the way you might measure whether or not something is punishing is by monitoring fear and uncertainty. So let's look at these groups again. So here's the guy who is bold, epigenetic negative, had no problems as a baby, never had any abuse, has a positive cognitive bias. This is the guy who can do it, right? This is the guy who can do it all. Yet this guy keeps going and going and going. And finally he says, you want to know something? There's nothing here for me. And the next time you ask me to do this, I'll give up more quickly. The bold dog who had epigenetic effects, was abused, but has a cognitive positive bias, becomes a little more forceful when he doesn't get an answer. And that would depend on the type of punishment he received. Time to punishment and aggression will shorten with exposure as intensity increases, but he gives up pretty early. The shy dog who has epigenetic effects, who was abused and is a pessimist, these responses are all driven by the abuse and epigenetic effects. They try and they stop. Withdrawal is likely and frank panic is likely. If all you're going to do is tell them what you don't want. The shy dog who was epigenetic negative, but was abused and has a negative cognitive bias, gives up. They just shut down, and withdrawal is more likely. With repetition, this dog isn't even going to engage in you. They're never going to get to the yes that's all the way down at the bottom here. So did anyone get to the point of offering the behavior that would be rewarded? And instead, tell dogs what's right and what you want them to do. So here we have an example of a dog who is bold, epigenetic negative, was never abused, has a positive cognitive bias, and he makes a few little changes. He takes the fastest path and he gets to yes. Okay, here we've got a dog who's bold. He's had some epigenetic effects. He was abused, but he's got a positive cognitive bias. He's still fast. He's reactive. He makes some mistakes. He learns because you're now telling him yes. So instead of no, 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 you're saying yes, yes, that was good, that was good, that was good. And then when you go in the other direction, there's no, that was good. And he comes back. Okay, I'll sample over here. That was good. That was good. He gets there and he can learn from absence cues if he can control his reactivity. The shy dog who's epigenetic positive, abuse positive, and has a negative cognitive bias, the responses, again, as I said, are going to be driven by the abuse and the epigenetic effects. It's a very hesitant dog and a very reactive dog. But with time, the dog will realize she says yes when I'm close and says nothing when I'm not. So when I move in the direction that gets me nothing, I need to move back in the direction that gets me a yes. And they will eventually, it will take a lot of time, they will get there. The absence cues aren't that helpful. The positive cues are very helpful for them. And then our very hesitant, slow, shy, epigenetic negative cognitive bias, pessimistic dog who's being abused is very slow. But if you gently encourage this dog with yes, they will figure it out and you can alter their cognitive bias. Over time, these dogs can learn to use absence cues. So over time, by saying, that was close, that was close, that was close, you can get there in a way with these dogs that you wouldn't because they work for accurate information. And you don't want to tell them the 999,000 things you didn't want. You want to tell them the thing you wanted. And that's usually what's missing. And the way we can do that is we use novel techniques. We use relaxation training. As I said, it's a cognitive behavioral therapy training. It's the first part of it, but it's needed for good communication and information processing skills. We use focus training needed for good communication skills. And we actually use the cognitive behavior training in cognitive and problem solving training needed to change behavior. So I'm going to show you how these work quickly in our last few minutes. This is Picasso, who's no longer with us, but was fabulous at this. So I hold a treat to my eye so he looks at my face. I start to bring the treat, which has an odorant. You know, dogs can smell food quite well. And dogs can't sniff and pant at the same time. So if he wants to take in the odor, he has to close his mouth. So I bring it close to him. And now what I'm going to do, I'm going to bring it even closer as he starts to close his mouth. He closes his mouth. Notice here that this is a normal nose and he's got oblong nostrils. I want his nostrils to be big and fat and round, and you're going to see that in a minute. So as we go from the top picture all the way around the arrows to the bottom picture, I reward his closing his mouth. And then finally, he pops open his nostrils. The top of his nose is flat. He's got round nostrils. He holds his breath, and I give him the treat. Okay, that's the steps that are involved in doing that. And these are the videos of dogs doing this. And you should be able to see this. Somebody tell me if you can't. Look at me. This is Pick holding his breath. Oops, sorry. Hold. Look. Look, minus, no. And this is one of our patients doing it in the clinic.
Perfect. Do it again. Breathe. Perfect. Look at me. Breathe. Perfect. Yeah. And she's getting.
And you can see him doing that. And the only price to pay is I'm covered in liver. So how do we do focus training? This is the lovely Missy Rose, and I am very slowly moving a toy. It's a yellow giraffe that's never been in a dog's mouth, no odor. And we've got this toy in the clinic and we use to test dogs. If they can't do this the way she can, they need to learn to do this before they can become less reactive. And you can see her tracking this, her pupils don't dilate. You can tell when it moves back and forth. This has volume. No one's making any noise. That's the type of focus we want. Calm, serene, collaborative, intentional focus where they can get information if they need it. And then we can do some cognitive games. And this is Hamilton when he was a baby.
Touch up, touch down, touch left, touch right, touch left again. Oh, what a good boy.
So it's not sufficient that he touches. He has to know right and left, up and down. He has to do all of these things, and then you can build on these. So in the beginning, I asked, what do we want? You know, and I said, inhibition. Well, what can we do? And ignore all the neuroscience here on the side. I'm not going to talk about that. But in inhibition, how can we get that? We can avoid it. We can give environmental enrichment from the patient's perspective so that there are other things that they're more interested in. We can just actively distract and redirect them. We can train an alternative behavior than the one they're using. We can actively desensitize them so they react to a lower level, and we can counter condition them so they offer an alternative behavior than the one that's problematic. If we want to extinguish behaviors, these things aren't going to help you. Training an alternative behavior might, desensitization and counter conditioning might. If you want to modulate the behaviors, well, you might want to avoid it. You could distract and redirect, train an alternative behavior, desensitize and counter conditioning. If you want to enhance this, we begin to get into some trouble. You can certainly offer some environmental enrichment and you can train an alternative behavior. But now you're in the zone where you have to teach the dog to relax, you have to teach the dog focus, and you have to teach the dog the cognitive training. If you want to stimulate the replacement of a learning behavior, environmental enrichment, an alternative behavior, and again, you're in the zone of, you have to add the relaxation, focus, and cognitive training. And if you want to facilitate social behaviors, you can train an alternate behavior, but you really need to rely on the relaxation, focus, and cognitive training. Notice that nowhere in this do I recommend punishment for anything. Okay. So the ability to use non-coercive, non-scary, non-painful techniques to enhance cognitive processes that facilitate beneficial change in underlying mental and emotional states is not simple. I didn't say it's simple. I started with definitions. I showed you data. I led you through the theory. I walked you through theory that now had a realistic basis in the underlying biology, showed you what could happen if you only punished and didn't give them accurate information, showed you what would happen if you gave them accurate information. And then we ended up with the techniques that could do that. I didn't say this was simple. I didn't say it was instantaneous. It's not. I want magic like everybody else. I want to click my heels together and I want it to all be better for everybody. It's not going to happen. But these non-coercive, non-scary, non-painful techniques that enhance cognitive processes are safe. They're sane. They're based in emergent science, and they're in the best interests of the dog. And it works. And no other approach can say that. Okay. So that's the logic. You can reach out to me. Here are my two most commonly used email addresses. There are free handouts and some videos on my website. the journal. This is the journal that I edit that has a lot of this type of stuff in it. If you want to reach out for appointments, you can go to the Animal Welfare Center website and go to the client's forms section. You already know about the spring seminars, and you can learn about the Behavior at the Beach course, which is sold out this year and has been sold out pretty much since we advertised it. But I'm hearing from enough people that if this goes well, there will be a 2024 version. Okay, sorry for the technical difficulties. I'm glad somebody finally told me, since I deliberately don't look at the Q&A when I'm talking. Yeah, Juanita said, can you mention noise sensitivities that occur or worsen with e-collars? Yeah, that's something that people don't think about. And it's not just e-collars. We had a client again the other day. It doesn't happen very often, but it happened here, where they can't even latch the snap of their lead to a collar. A choke collar would certainly make a noise that they found aversive. And anytime you've got beeps, you know, and you should find out how dogs react to beeps in any case, that we all say, oh, well, a noise is going to be so much more superior. Not if they're sensitive to that range of noises. One of the things I'm hoping to get done this year is to work with one of our neuroscientists who has worked on ultrasonographic communications in rodents. We're trying to figure out how household noises and these other noises of tools that we use with dogs affect dogs, and how much of that is real world noise that we could hear and that they hear, how much of it may have noise sensitivities outside the range that we would hear and maybe outside the range they would hear. We know very little about ultrasound in dogs, but the stuff we do know, anything having to do with training can affect a noise reactive dog, even the place where you train. And for this reason, when we do all of our cognitive testing on dogs and cats, we measure the decibel level of the background environment, and we always try to keep it in the 30s and 40s, which is very, 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 very quiet. And if you're worried about decibels, by the way, there are any number of really good decibel meters you can download to your phone, including the NIOSH one. It's free download, and you just turn on your phone, you hit the button, and it will tell you the decibel level. Prong collar equal to shock collar? Interesting question. Very, 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 very much depends on the dog. Your relationship with the dog is not the same with a prong collar and a shock collar, because with a prong collar, your only intent is to hurt the dog. And I know that that's not how people think about it, but it is what happens, and it's why they have scars and why you can have mucopurulent lesions. And the sound of a prong collar can be enough. And I have a series of pictures that I use in the lectures on aggression, where for those of you who saw the DAO last week, you saw that dog wearing a prong collar. And the second we took that prong collar off, that dog stood up normally in a harness. And all we did was just fit it with a harness and take away the thing that it learned could hurt it. Barbara, for those dogs who have a history of aversive training, when training techniques are changed, can full signaling of the dogs return to a more normal basis? Wow, that is a great question. The answer theoretically, of course, is yes. How much damage was done to the dog, and whether that dog was bold or shy, whether they had abuse, how reactive they are is all going to matter. So I'll tell you a backdoor answer to that. One of my residents, Deb Bryant, for her research paper, looked at the cognitive test that we use for our pet dogs and the working dogs. The pet dogs were compared to the working dogs. And she just looked at the signals sit, stay, and down. And what she found out is, much to her shock, and you saw when these working dogs did these signals, that, you know, you think that they'll tap dance their way through anything. I mean, they find bombs. Why won't they tap dance? She found out as she's watching these, she's like, these dogs are doing worse with these signals. And I know they don't put hard obedience on them, but they're doing worse with these signals than pet dogs. Not only did they do worse, they had dropped out a third of the canine signals. So when we looked at the responses the dogs had to being asked to sit down or stay, when we looked at all the behaviors, the working dogs had dropped out 33% of the canine behavior repertoire. Why? because no one had rewarded them for it. The handlers were only looking at whether or not they complied with what they were taught. So it was a yes, no. You know, it's like the gun fired or it didn't, the car started or it didn't. You're issued a dog, a vehicle, and a gun. Which one doesn't fit? Shannon, can you speak to breaking down mental barriers for clients who cannot see another way to contain their dogs on a large property and have no problem with the dog experience the shock only once? This is the single most difficult discussion I think we have with especially islanders, because there's a lot of land. Houses can be sparse. Also, PI has a free-ranging dog problem of own dogs. These are not stray dogs. These are own dogs. I have met all of my neighbors' dogs in my yard, okay, because they come to visit my dogs because they're not on a lead, and I have a fence. So you can ask yourself how they get around the fence. But people here use invisible fences because they're inexpensive and, quote, the dog is shocked only once. The dog is never shocked only once. And let me tell you what happened in our cognitive study. And when I tell people this, it gives them pause. One of the things that we did is we have a series of boxes, and one of them will have a toy or a treat in it. And they're randomized, and we knock on them, or we point at them, or we stare at them, or we stick a blue flag in them. Dogs can see blue. We stick a blue flag in them. And the dogs are outside the room when we set up the boxes. And then when we're going to do that run, we let the dog in. They do that. We reset, you know, so they do this a dozen, 15 times. The dog comes in and the blue flag is there. And the number of dogs that dropped or salivated or picked up a paw or wouldn't go forward was great. And it took me a couple of dogs to say, by the way, do you have an invisible fence? So the flag was aversive. Forget about the shock. And what we've recommended is that if your point is to let the dog out so they can go wee, you can fence in a very small portion of your yard. And really what you'd like to do is fence in a portion off your deck. And that can be done inexpensively in a variety of formats. And as soon as we've suggested that, and then you can walk with the dog or take the dog for a walk, depends on how well trained the dog is, whether he needs a leash, depending on where you're walking. Any dog who can be aggressive, who may bite or has bitten, needs to be on a lead and a head collar, or a lead and a muzzle to which they were trained. And if they are off lead, and I don't care if you have 30 acres, if there is any chance of a path or a road or somebody coming to deliver something, that dog is off lead, that dog is muzzle trained, that dog is on a muzzle. We've put him on notice that this dog could bite. We don't need a tragedy with the RCMP involved. But in these situations, people realize, oh, well, I can have the best of both worlds. And that's what we aim for. I'm always looking for a negotiated settlement. You know, nobody gets everything they want, but everybody can get everything they need. That's what we do.